Thank you for watching this special presentation of Denver 7 News. I'm Jason Gruenauer. Take one look at the comments on our social media accounts or at the 360 email inbox, and one thing is clear. Coloradans have questions when it comes to the coronavirus vaccine, and Denver 7 is committed to answering as many of those questions as we possibly can. That's why I recently sat down with Dr. Michelle Barron, an infectious disease expert at UC Health, to take questions straight to the source. The first question, and probably the most widely asked, is the vaccine safe? Dr. Barron says unequivocally, yes.
Yes, it is very safe. So I think one of the things that people were very worried about was that it was done in a very short time frame. And so that maybe people cut corners or things weren't done like we normally do. The scientific design was the standard that we used for all sorts of studies, including the standard vaccines. The big difference was obviously it was done sooner and quicker. And the reason why? They had lots of money. Studies are not typically funded to this degree with this amount of support. I mean, they actually had a mobile clinic that they could drive around and bring access to individuals interested, whereas most of the time they have to take off work and then come in and do all these things. So they had a lot more resources than we've ever had. I took the vaccine. My family is getting their vaccine as appropriate. And so I certainly would encourage others to consider it when they become eligible.
I read an article that basically said it's rare, if ever, that all of science is dedicated towards one thing at one time, and that includes the funding behind it, which goes to your comment about the timeline of getting this vaccine out, that literally it was everyone around the world's goal was to get a vaccine, and that's why we got one out so quickly.
It is, and it truly is the biggest scientific achievement that we've had in my lifetime. There's been a lot of things we've moved in medicine, and this one is remarkable because exactly that. The brightest people in the world figured this out. The technology is not new, too. I think that's something that I really want people to really understand. Some of this people have been working on this technology for decades. It's just never actually been used because we didn't need to.
In addition to the abbreviated timeline, some vaccine skepticism comes from not knowing what's in the vaccine itself. And that's understandable. The coronavirus vaccine is different from past vaccines. It's what's called an mRNA vaccine. Here's how the Centers for Disease Control and Prevention puts it. Many other vaccines put a weakened or inactivated germ into our bodies to fight a virus, not mRNA vaccines. Instead, they teach our cells how to make a protein or even just a piece of a protein that triggers an immune response inside our bodies. That immune response, which produces antibodies, is what protects us from getting infected if the real virus enters our bodies. Here's how Dr. Barron describes an mRNA vaccine.
Just think about it as like you're trying to replicate my hair and my face so that you would be able to recognize me when you see me. So the mRNA is the precursor, the code that would then make my photo appear. And then when it appears in your immune system, and then the immune system says, hey, she looks familiar. She doesn't belong here. We need to get rid of her. Then the next time, so that's how the vaccine in theory works. When you get the booster, the body's now said, yeah, I've seen her before, and she does not belong here. And so then again, the immune response is to basically attack and remove, in this case, the virus, hopefully not me, and allows that to actually do its job. So that's the technology behind it. And the mRNA is very delicate. This is why you need all these freezers and all these things that people are sort of add to the complications of how to give the vaccine. I think there was a lot of stuff out there that, it gets into your DNA and then it mixes. mRNA doesn't work that way. And in fact, our bodies, we make our own mRNAs, and that's how our hair grows. That's how our skin will reproduce itself. This is a common thing we normally have. It's just manipulating it for our immune system to do what it's supposed to do.
So to be clear, RNA is not DNA, so the coronavirus vaccine won't affect your DNA at all, as some myths floating around might try to tell you. Reporter Larissa Scott with our sister station in Tampa debunks a few other myths associated with the vaccine.
As community COVID-19 vaccinations continue, there's still a lot of misinformation out there about the vaccine, how it works, and its safety. Despite common misconception, experts tell us you cannot get COVID-19 from the vaccine. Another myth out there is fear that the vaccine can make you infertile. Doctors say that's just not possible, and there are no recorded cases of that happening.
You're getting injected in your arm. So it's an intramuscular injection here. So I'm not sure how it would affect your reproductive organs.
And experts tell us one of the most confusing myths of all is one that claims the vaccine was developed as a means to inject a microchip into our bodies to control the population. Doctors say not only is this one so far from the truth, it's also not possible or logical.
If you actually go and see how the vaccine is given to people, they have a little vial. It has a white powder in it. They have to put water into it, or saline solution into it, in order to reconstitute it. If there's a microchip in there, it's going to be dosed in water, which is probably not good for circuitry.
Reporting in Tampa, Larissa Scott, ABC Action News.
So the vaccine is safe and doesn't put any of the virus inside our body. That doesn't mean, though, that there won't be side effects. Dr. Barron walked us through the side effects you should expect, including her firsthand account and what signs to look out for after you get your shot.
The first side effect that someone can have is some kind of an allergic reaction. And that is why it's recommended that you be watched for after you get your vaccine. They have you sit down. They'll watch you somewhere between 5 to 15 minutes. And make sure that you don't have any immediate swelling of your mouth or difficulty breathing. And that happens incredibly rarely. Most people are going to have a sore arm after the vaccine. Some people will have mild fevers. Some people have had headaches, some body aches. This seems to be worse after the second vaccine. And I can actually attest to this. After the second vaccine, I felt really, really tired. I had some really terrible muscle aches, some body aches. I had a fever. And then it went away. You should not have any respiratory symptoms after either one of them. So the vaccine can certainly make you feel like you have the flu. Sometimes you can get rashes as well. That's another thing that's been commonly reported. But you should not have a cough or shortness of breath or a runny nose. You can still get COVID between getting your first shot and your second shot. And even after the second shot, you need at least 14 days for full effect. So if you develop any of those respiratory symptoms, that is not a common side effect. And you probably want to talk to somebody that takes care of you, one of your providers, to make sure that you haven't by chance developed COVID.
Another important note, the CDC recommends you still wear a mask and avoid close contact with others even after you've received both doses of the vaccine. Well, it's felt like a moving target since the vaccine arrived. The timeline of exactly when Coloradans can get their shots. After the break, we hear from Dr. Barron and state officials on what the latest timeline looks like. Plus, the focus on vaccine equity in the fight against COVID-19. Welcome back. A lot of the questions we've been getting since the introduction of this vaccine is, when can I get mine? And who is eligible when? Let's bring you up to speed on the latest from the state and their distribution order. Healthcare workers and those in nursing homes went first. That was phase 1A. Then phase 1B1 opened things up to those 70 and up. The state's goal is to vaccinate 70% of that group by the end of February. The next phase, which opened up on February 8th, includes those 65 to 69 and educators and childcare workers.
Everybody who is 70 and up will be able to get it in February. Those 65 and up will take into that first week in March till we can get through that entire group. But there are some folks 65 and up beginning to receive it today or earlier this week.
Now, as we move through the phases, equity is also so important. Newsy's Kat Sandoval explains the moves being made to make sure shots are available to all communities that want them.
To ensure equity in vaccine distribution, the White House will provide vaccines directly to 250 community health centers. The announcement comes with a promise to increase supplies to states and tribes by 28% over when President Biden took office.
We are providing a suite of tools to state and local leaders as they work to reach their underserved and hardest hit populations.
Early data shows that communities of color are receiving disproportionately smaller shares of the vaccines.
We can't have large sections of the community going unvaccinated in order to get to that next stage.
In 23 states, Black and Hispanic people are receiving disproportionately low numbers of vaccinations.
You know why some Black people don't trust the vaccine? Things like the Tuskegee experiment.
Vaccine hesitation stems from past inhumane experimentation, and experts say vaccine education, particularly by local health and community leaders, can help answer questions or concerns.
If we have a swell of individuals in underserved communities say, we want the vaccine, we'll figure it out. There are not a Walgreens or a CVS down the street in many of these communities. We know that that's going to be a bottleneck for those individuals in those communities.
To target underserved areas, the administration also plans on providing mobile clinics.
What we need to think about is really making sure that these sites are located in communities where they're easily accessible, where you don't have to have a car to get the vaccine, where you can make a phone appointment instead of having high-speed internet connections.
For Newsy, I'm Kat Sandoval.
Denver Mayor Michael Hancock also spoke about the importance of getting doses into all communities.
Underscore what Bob made mention of that is important to us. One, these helping us get to our communities that are perennially overlooked and typically are most challenged and have been most challenged during this COVID pandemic. Setting up static or permanent sites is going to be critically important to us, where residents can predict and can expect that these sites are there for themselves as we get through the various levels of vaccination. And so this is critical for us to continue to reach those who are in 1A, and 1B and 1B2 as we go forward. Bob, you want to continue to talk about how folks can access this registration?
To achieve vaccine equity, or try to get as close to it as possible, the mayor says the city of Denver will be opening vaccine community sites in Montbello, Northeast Denver, East Denver, and Northwest Denver. Local leaders have repeated it over and over, though. How quickly we can get shots out is entirely dependent on how many shots there are available from the federal government. But that part of this equation is causing some frustration for those who have signed up to receive a vaccine but haven't been able to yet. Let's continue this conversation about distribution and get back to my conversation with UC Health's Dr. Michelle Barron. What should people do if they're signed up and they're waiting, but they haven't heard back yet?
So obviously make sure that the way you've signed up has the correct information so that you can be contacted. I know not everyone has access to the internet or to computers. There are now hotlines and phone numbers that can help work you through this, and they can make sure that you get that call. It's, like all things, unfortunately, it's being patient. I know that's really hard given how long people have been waiting for this and the anxiety. I can tell you from having parents that live in other states, we are still so far ahead of the game in terms of our process. And it does take some time, but I think it's certainly a little simpler to some degree in that, you'll get that phone call, you'll get that email or that message, and it will come. It's just, again, and I will tell everybody, there is no need to stay within the group that maybe your insurance is with or your doctor is affiliated with. You literally can sign, the state of Colorado, you can sign up with any hospital system or the state anywhere. And that just maximizes the chance that, this group is going faster than this group, they got you in. And so I would being on multiple lists is not a bad thing.
Coming up, why one group over another? We dig into the timing of opening up to other groups, including a 360 look at the debate over moving up the homeless population in line. That's next. Welcome back. Why this group and not that one? Why this age and not pre-existing conditions? These are questions we've continued to receive from you, our viewers. Infectious disease expert Dr. Michelle Barron weighed in on why age is the most important factor.
If you looked purely at who's at most risk of being hospitalized and dying, the 70 plus, without a doubt, was so many magnitudes higher than every other age group that was the decision of they are the most vulnerable. They are the ones that probably need the most protection. Realizing, again, there will be exceptions. There will be others in other age groups that also could be potentially at risk, but there's no sort of way to do this in a very systematic fashion without making some rules. And in some of the rules, some people, even though they should have qualified, don't, but they still will get the vaccine. I think that's the long-term goal, is that everybody will have access to a vaccine in the near future.
When we're talking about the timing of eligibility and when the next phases begin here in Colorado, it's been the source of a question and frustration. Why open eligibility up to teachers, for example, when all of those 70 plus haven't gotten their shots yet? Governor Polis was asked that exact question during a recent media briefing.
Yeah, so the goal is for everybody, for 70% of those 70 and up to be vaccinated by the end of February. If we limited vaccines only to those 70 and up, we would not be able to deploy vaccines fast enough, and vaccines would sit on shelves in Colorado. As you get towards the latter half of any group, you need to open up the next group so that you don't create a bottleneck of demand. So 65 to 69, there's some that are starting to get mixed in this week in different parts of our state that have made more progress with 70 and up. There'll be more 65 to 69 mixed in the week after that, the week after that. But without those doses would likely sit on shelves. And so it's very important that we rapid turnaround, every dose used within 3 days, that we have a sufficient demand. And while there are still some people 70 and up that are waiting, and they will get it in February, we wanted to make sure that we didn't create a bottleneck that kept vaccine on shelves when there's plenty of willing folks 65 to 69 ready to receive it.
Now, there has been some movement within each phase, and some groups recently added in and others being advocated for. Restaurant workers were recently moved up into Phase 1B3, the next to come on the list, along with other essential workers. Advocates have told Denver 7 they want to see those with intellectual and developmental disabilities also moved up in line. And then there's another vulnerable population here in Colorado, the homeless. Denver 7's Sloan Dickey takes a 360 look at their vaccine future.
We've seen great eagerness from people experiencing homelessness to get vaccinated.
As vaccines roll out for vulnerable populations across Colorado, one vulnerable population, people experiencing homelessness, gained a strong public advocate.
Here in Denver, we have a much stronger need because of the size of our persons experiencing homelessness.
The city of Denver is urging the state to prioritize homeless residents in its vaccine rollout rather than strictly adhering to the state's age-based approach. The move has stirred opinions on all sides, and we're here to share them with you. In tonight's 360, you'll hear from a range of people, including city employees, homeless advocates, and Denver residents. And you, our Denver 7 viewers, have strong opinions. First, what led the city to decide it needed to prioritize Denver's homeless population?
We have a high rate of people that are at high risk to negative consequences from COVID-19, and we have congregate living settings.
Currently, the state does not prioritize its unhoused as a vulnerable population.
It doesn't make sense to go to a shelter where there might be 300 or 400 people and only vaccinate those that meet a certain age requirement or that have a certain healthcare condition.
Kathy Alderman of the Colorado Coalition for the Homeless says vaccinating those in homeless shelters is a huge step to preventing hospital overflow and helping flatten the curve.
People that are experiencing homelessness are more likely to require hospitalization. An outbreak within a shelter where 250, 300 individuals might be could put enormous pressure on the hospital system.
Advocates say homeless means vulnerable.
I think it's well-founded. I think people who cannot retreat and keep themselves isolated from other people by necessity probably have a great need to have the vaccine available to them first.
But the governor's plan focuses on age and occupation, starting with those 70 and up, first responders, and now adding those 65 to 69 to the vaccine list, and educators. We've reached out to the governor's office on the potential to prioritize homeless. We're still waiting to hear back.
It should be based on age overall and pre-existing conditions.
So many of you are weighing in on social media. Barbara writes, "Are you kidding me? My husband is a liver transplant with no immune system, and I'm 68 and number 58,000 on the Kaiser list. Who comes up with this nonsense?" Tyler writes, "Probably should focus on taxpayers first." And another Denver 7 viewer writes, "Shouldn't they be just as much a priority as the rest?"
I think that's a scientific decision, really, to determine what is the risk reward in terms of, particularly severe illness and death.
Even if the state decides to prioritize its homeless residents, a major disagreement remains. Should the vaccine go to all of Denver's unhoused or just those living in shelters?
While we would love to see more planning take place for people that are sleeping outside or that are in encampments, we're really focused on these congregate settings.
Regardless of the answer, the reality of Denver's vulnerable population on the streets is hard to ignore.
Those of us who can retreat and social distance, we can wait a few more weeks until the more vaccines come out, because the homeless can't wait a few more weeks until vaccines come out.
Sloan Dickey, Denver 7.
Still many more questions to be answered, and we break down who's next in line to receive their vaccines and when. That's next. Welcome back. Time to tie up just a few loose ends with your questions before we get to who's next in line. There is a lot of optimism out there about the fact that vaccines are being distributed. But UC Health's Dr. Michelle Barron wants you to know that just because shots are starting to go into arms, we aren't out of the woods quite yet, including your ability to still contract the virus and our immediate future wearing masks.
The biggest protection it does is prevents you from getting very sick or ending up in the hospital. It also mostly protects you against getting infected, but not 100%. So you can get infected, you can potentially spread it to others, and you may not even realize it because you may be feeling just mildly ill and just think, I'm just tired because I didn't sleep well last night. And that's why it's so important at this point in time to continue to wear your masks, continue to do hand hygiene, social distancing, and limiting gatherings. I completely understand everybody wanting to be able to live life as freely as possible, and we're getting there, but we're just not quite ready yet to give up on these other things for those just in cases.
Now let's talk next steps. Again, the governor, local mayors, and health departments have all said that our timeline on getting the vaccine all depend on what's shipped from the federal government. It all comes down to supply. Timing could also move up if new vaccines are approved and shipped out. For now, let's talk about the next phases from the state. Phase 1B3 comes next after teachers and those 65 plus. That group includes essential workers like those in the postal service, public transit, and grocery workers. It also now includes restaurant workers and faith leaders, as well as those with 2 or more high-risk conditions, including cancer and heart conditions. Then after that comes phase 2, people over 60 and those with just 1 pre-existing condition. Then the rest of the general public will follow in phase 3. We hope that you've learned more about the vaccine, the distribution plan, and all of those phases. We know it's complicated and it seems to be ever-changing. So if you have a specific question, you can reach out to the state hotline 24/7 at the number right there on your screen. We also have our website updated as soon as new vaccine info comes in. Just head on over to thedenverchannel.com/vaccines. If you're still having trouble or have a concern you'd like to raise, you can always email us, contact7@thedenverchannel.com. Thanks so much for watching. Stay safe, Colorado. I'm Jason Gruenauer.